Healthcare workers are essential for treating patients with the coronavirus, but their jobs also increase the risk of infection. That's why the Massachusetts Nurses Association has been raising alarms about the expected shortage of personal protective equipment. To tell us about the protection and other concerns around patient care is the association's president, Donna Kelly Williams. Thank you very much for being with us, Donna.
Thanks so much, Chris, for having us.
So I want to start with the news that we've been seeing, certainly, about healthcare workers in Boston coming down with the virus. So what's your feeling about this?
We're living in a very frightening time right now, Chris, but what we do know is that we have to assume at this point that everyone is positive or presumed positive at this point. And in order to be able to care for people, we have to protect the very people that we want on the front lines to be able to take care of people when they become ill. And in order to do that safely, our front line has to be equipped with the fullest protection of PPE or personal protective equipment. Starting off with an N95 mask, which is a mask that kind of looks like a cupcake in its shape, but it fits very snugly to the face. And it's also made of a material that prevents any particles from going through it that would prevent the spread of the infection. Those masks are critical for people on the front line. And when I say the front line, it's not just the nurses and the nursing assistants and the doctors, but that's the firefighters and the police officers, and then even to go further with the people that are cleaning up at the hospitals, delivering the food. This is everyone. We have to assume that everyone that we come in contact right now is a potential positive COVID-19.
These are not the kind of masks that volunteers can make with a sewing machine and a certain amount of fabric. What about the supply in Massachusetts? Do you think this is going to run out pretty soon, maybe, for these
If we
kinds
don't
of
get
masks?
on this, yes, we are going to run out of it, Chris. And that's why we've asked for manufacturers to start making them as quickly as they possibly can. We've put out the alarm to everyone to make donations of anything that they can, even if it's not hospital grade at this point, certainly a grade that is sufficient enough to prevent particles from being transmitted. Anything that will safely protect our healthcare workforce right now, our first responders, is something that we need to have in place right now. And it needs to be consistent. Unfortunately, what we're seeing right now is an inconsistency in the directive that our frontline staff is receiving from administrators. We know what works, and we know how important it is that the messaging is consistent and it is the safest possible.
Well, one of the B plans we're hearing about is that there might be a way to make the masks safely reusable. What do you think about that?
That should be a last resort. Chris, those masks are intended for single use only. We're dropping the standards based on the CDC recommendations to apply to what we have for resources, not the safest standard. And what we're saying is we need to apply the safest standard possible and to get on the road and get these things manufactured and to the front line as quickly as possible. We need to do everything that we can. And having talked with as many people as we have over the past week, we have to say that people are trying very, very hard to get those PPE to the front line. And we too are working as fast and as hard as we can to ensure that every possible opportunity to get PPE to the front line is being utilized.
By the way, you heard the governor's frustration yesterday. So is this the state not doing enough? Is it the federal government not doing enough? Or what is it, you think?
Well, and this would be my opinion, Chris. I think it's the federal government that's not doing enough. Certainly, I also listened to the governor, and the governor has received letters from us of what we are seeing on the front line. But you can only do what you can do. And as he said yesterday, they've put in multiple orders that were stopped, that they did not receive them. And the only thing he can count on right now is what is actually in his possession. And that's a real problem. We should be getting what we need right now because we don't want to become the next hot spot. We know what New York is going through right now. We're in constant communication with New York and the California nurses and the Minnesota nurses. All over the country, we're talking to nurses, including our friends across the pond in Ireland have been reaching out to us. So we know what's coming with the next tidal wave, and we know what we need to do to prepare for that. And that's what we outlined in our letter to the governor. So not only providing the highest quality PPE, getting the manufacturers to get on board and get those out as quickly as possible, to stop the manufacturing of ventilators, which we know now that the next phase, when you go from being COVID positive with mild symptoms to COVID positive with more critical symptoms, that you're going to need the aid of a ventilator to keep air flowing into your lungs and to rest your heart while you heal. And in order to do that, you have to have a tube in your throat, and you need to be hooked up to a machine that will breathe for you. And under normal circumstances, someone with a pneumonia might be on that machine for 3 or 4 days, maybe a few days longer, depending. But somebody with COVID-19, pneumonia complications are going to be on that ventilator for 11 to 21 days. So the turnover is not going to be quite as quickly. So we need to ensure that we have those machines being manufactured right now, because as we go from New York we went from Washington to California, now we're in New York, and now we're looking at Louisiana. In addition to what we're seeing here in Boston, we don't have enough equipment.
Speaking of B plans, there's also talk of having multiple patients on a single ventilator. I know that you don't want to see that. No one really wants to see that. But if that has to happen, what does that mean for a nurse working bedside?
It's very challenging, very, very challenging, because the nurse that's taking care of the patient that requires ventilation is a critical care nurse. That's a nurse who's specialized in taking care of the most critical patients. So in order to do that, that nurse has to be fully masked, gowned, and gloved, him or herself, as well as now managing 2 critically ill patients that are tethered to the same machine. There's also talk of being able to have the capability of adding 4 patients to one machine, which means there'll be 4 patients that will be tethered together, and certainly they would have more than one nurse applied to that situation.
What about patients in intensive care? And I imagine there's a lot of overlap here with the ventilator situation. I think the norm, correct me if I have this wrong, the norm is 1 single person per unit. And what if there are multiple people per unit? You're worried about that. What could that mean?
You mean 1 person to...
If you have more than 1 person in an intensive care unit that maybe have to be looked after almost simultaneously?
Right. That's what we see under normal circumstances, that there could be multiple patients within an intensive care unit that require 1 nurse to 1 patient, or sometimes even so critical that they need 2 nurses to 1 patient. So what we're looking at now is what are the resources that we can do to support those critical care nurses that are working in those areas that might be stretched as thin as they possibly can, to utilize the nurses from other areas who have specialties in other areas that could support those nurses and be the runners or be the extra set of hands, the extra pair of eyes on that patient. Because those, we have to keep in mind too, Chris, is those are the very patients that are not going to have a loved one beside them. This is so frightening for people to think about getting to that point where you're critically ill and requiring a ventilator to breathe for you, but not being able to hold the hand of your loved one.
Ordinarily, it would be okay for a nurse to make the run for medications, let's say, but how much time could that take, and what could happen during that time?
So you have to take your eyes off the patient if you have to go out to get a medication or get something that you don't have at the bedside. That would require removing all of your PPE, taking off your mask, your glove, your headgear, your overcover, your shoe covers. Everything would have to come off, be left at the bedside. You'd then have to wash your hands, and then you'd have to make your way to whatever piece of equipment that you would have to get. Then you would have to repeat the process of putting all of that equipment back on before you entered the room. But if you had that runner or an extra pair of eyes that could help you out with that, you could signal to them and they could bring it to you rather than you having to leave and do all of that, which is extremely time consuming and takes your eyes off of the patient.
I want to come back to one of the first things you mentioned, and that you say that right now, anybody who comes into a healthcare setting has to be considered just by default as being a coronavirus positive. Why is that necessary?
Because what we've learned is that the great majority of people that are transmitters right now are positive but not showing symptoms, because this virus does not hit everybody the same. So for 80% of the population, they may have mild or no symptoms whatsoever. And in order to convert to being able to be testing positive so that we could really track you, that usually takes about 5 days into the illness. So even if you are symptomatic for the first couple of days, until we can get a really good sample, we probably wouldn't see a conversion for at least 5 days.
What about the effect right now on workload for people? I'm not talking about caregivers per patient. I'm just talking about the kind of schedules that people are on and the kind of stress that's putting on them. What are you hearing?
I'm hearing a lot from our nurses and our other healthcare frontline providers. It's terrifying, the mixed messages that they're receiving, the lowering of the standards by the CDC. And this is new territory. We don't want to be placing blame at this point, but what we do want to do is, we know most of what will work from the experience that other countries and other states have had. We need to heed their warning, and we need to do what we can do to best protect that frontline staff that is going to be there to take care of all of us and our loved ones.
When you look at these other places, is there a warning that you're aware of that we ought to pay more attention to right here?
Absolutely. And that warning is, assume everyone is positive and make sure that we stop the manufacturing of the PPE, the personal protective equipment of the highest quality, and get those ventilators ready for the people that are going to need it. Because nurses are not only giving physical and medical support, but we're also giving emotional support, not only to our patients, but to our loved ones and to each other.